shift you can make is how to approach your medical care. Joining me now to explain just some of the benefits of functional medicine is the CEO and founder of Back to Health Functional Medicine and the best-selling author of You Can't Outrun Your Fork, Dr. Anya Szigeti. It is so great to see you.
Great, thank you, Gail. Great to be here again.
So, Dr. Anya, let's talk about this growing field of functional medicine. I think a lot of people are just becoming frustrated with the system as it is. And they want more answers so they can get to the bottom of what's going on with their healthcare needs.
Yes, Gail, it's very unfortunate, actually. A lot of people are suffering, and I suffered on my own health journey as well with the options that were given to me for my own care. And the beautiful thing with root cause functional medicine is it actually gets to the root of the issues and looks at all the different factors that really affect our health to make us more optimized for our health span, not just for our lifespan.
You know, I think I had to go the functional medicine route to get to the bottom of what was going on with my health. And while I was bitter in the beginning about having to pay out of pocket to do so, I realized that I was just buying supplements blindly and grabbing on to anything that anyone said to feel better, and it wasn't working. And if you can actually get that extra blood work done, you know, find out maybe what foods you're sensitive to, all of these different ways of healing that can make a profound impact.
Absolutely. So one way I look at it is like a plant. And the way that functional medicine looks at it is we're looking at the roots of the plant, the soil, the nourishment in the soil. Does the plant have enough water and sunlight? All those factors are going to make a really healthy plant. Whereas oftentimes with allopathic medicine, we're looking at, okay, maybe the leaves are discolored. Let's trim the leaf to get rid of the discoloration. Yes, it'll look better temporarily, but that's a short-term solution. That's not for longevity and for our health span.
And by just cutting off the dead leaves, you know, you're doing it just like a broad blanket, treating everybody the same way. Functional medicine is more to the individual's needs.
Yes, exactly. And so there's three main differences that you're going to see with functional medicine versus the allopathic model, and one of them being that individual care, looking specific to the person. Like you've shared on here several times, and myself as well, we both have hypothyroidism, but we are completely unique in our health journey, our environment, all these different factors that affect our health. And so a blanket treatment isn't going to work for both of us to get to the root cause of our actual health imbalances within our body.
Yeah, I mean, for my specific, just to make you understand how, what Dr. Anya is trying to say here, for me, they just kept upping the thyroid medication. I was trembling, I didn't feel good, I felt on edge all the time, only to find out that the T3 and the T4, which I didn't even know what that was, didn't need the same amount of medication. And one was getting blasted and over-medicated. And so I felt like a mess. So what is your advice to people if they just feel like they're hitting their heads up against the wall when it comes to traditional medical care?
One is just being aware with your own body and really understanding what is going on inside and being your own health advocate, which is what I had to do as well. And knowing that, you know, in my health struggles, I felt very hopeless and helpless because I didn't know there were other alternatives. And so that's why this is a beautiful message, and I thank you for the opportunity to share that there is other options out there. There are other ways to approach things, and looking at the foundations. Let's look at the diet. Let's look at the lifestyle factors and see where the things are imbalanced for you individually, and start to work on those and work towards building a strong foundation so that you can live your healthiest life and thrive.
All right, so you were running us through three main areas to look at. We have two more to go. So talk to me about the three main benefits of root cause holistic functional medicine, and now we're on focusing on prevention.
Yes, so preventative care is a huge piece of it as well. Instead of just looking at the different symptoms that you're having and waiting and being reactive, prevention is looking, the holistic functional medicine is looking at being preventative, and again, building that foundation and making sure that we have the dietary and lifestyle pieces optimized so that we don't need to react to things. So we're able to be healthier in response to things.
And then last but not least, you talk about, you know, the patient-centered approach. And we kind of did touch on this when it comes to everyone should not be treated equally if they're, just because they might have the same condition, like you and I both have hypothyroidism.
Exactly. The patient-centered approach, for sure, with individualized approach, but then also looking at all the different systems instead of just looking at your thyroid, which it sounds like your doctors are doing for you and we're doing for me as well, because the thyroid runs so many things within our body. Our gut runs so many things within our body. If we just pull out that one organ and look at that one specific system, we're discrediting the rest of the factors in health. So we need to look at the entire holistic picture, the entire environment, mental health, hydration, stress response, the diet, the lifestyle. All these factors need to be evaluated and optimized for optimal health.
So when you go to a functional medicine doctor, I mean, they're ordering labs, they're checking, you know, to see food sensitivities. I mean, there's a lot that goes into getting to the root cause of the problem.
Yes, and an area that I really focus on and specialize with my patients is gut health. And I feel that even Hippocrates said that all disease begins in the gut. I believe that all health begins in the gut. And so when I work with my patients, I do super in-depth work with them initially to learn about their health journey and all the different struggles that they've been through. We look at genetic factors, which does play a small role, but it does play a role. We look at dietary habits, lifestyle habits, all these different pieces of the puzzle, even before I recommend testing, because I want to get to know you as best I can. And then we look at different types of testing. And I don't order the same test for every single patient because everyone's so unique. So when I pick out blood work, I'm picking that out based on their specific lifestyle factors that we've discussed and investigated. I look at digestive health. You know, I mentioned stool testing in previous episodes. I definitely use that. We look at hormones. We look at so many different factors, food sensitivities, whatever we need to uncover and peel back the layers of the onion for each individual. We're going to dive in and do that work with them.
Yeah, it's really interesting, the work that's being done with functional medicine. It's a game changer with how you feel.
It's transformative.
I mean, I often wake up every morning and I'm like, I can't believe I feel okay and balanced.
Yes.
Dr. Anya, thank you so much. And we're going to, of course, share all of this advice with you on BloomTampaBay.com.